Earlier, we talked about protecting yourself from sports injuries as well as people getting more active as temperatures start to warm up. But you also need to make sure you're protecting your skin from sun damage, especially when you're outside. This morning, we're talking to Dr. Ashley Wentworth, a dermatologist at Mayo Clinic, about the simple steps to avoid heat and sun-related injuries. Good morning, Dr. Wentworth. Thank you so much for joining us.
Good morning. Thank you so much for having me.
So let's start with the best practices for sunscreen. When should we wear it and what type should we wear?
Well, that's a great question. I tell my patients that anytime they're anticipating being outside in the sun for more than about 15 minutes or so, to try to remember to apply sunscreen before they go out. And even on overcast days, we can have sun exposure that creeps through those clouds. And so it's a good practice just to get into the routine of at least applying sunscreen to your face on a daily basis and then making sure to reapply throughout the day.
And speaking of reapplying, how often should you reapply? What if, you're outside, you're sweating, or you want to go into the pool? Is there a preferred strategy?
I'm glad you asked that because I think that's the main problem where all of us, even dermatologists, get into trouble. We remember that first application right when we get to the beach or the pool or go for a long run, but you do need to reapply about every 1 to 2 hours in order to maintain that coverage, as well as you mentioned, applying after you've gotten in the water or done a lot of sweating. And so maybe setting a timer on your phone or giving that as a kind of task for one of the family members to put everyone on the alert to reapply their sunscreen every so often.
And is there a difference between, the spray versus the cream? Is one better than the other?
A lot of my patients like the spray for convenience. I tend to prefer, at least for the first application of the day, using the cream. And that way you get good coverage, you know where you put it on, you know it got rubbed in. And then I think the spray is a great option for quick reapplications to ease convenience, and then also for hard to reach areas like the back or for kids running around on a busy day, just kind of getting that quick application in.
Okay. Well, let's talk a little bit about people of color. I know a lot of us are under the impression that because we're not so easily burned that we don't need sunscreen. Is this true? Tell me a little bit about that.
Well, and that's an important point to make because the thinking on this has changed over years. You're correct that for many years we thought that patients who had a skin type that didn't burn easily weren't at as great of a risk for skin cancer. But now we know that all skin types are susceptible to skin cancer. So I encourage my patients, regardless of skin type or history or tendency to burn, to apply sunscreen. Some of the most latest and greatest research suggests that patients with skin of color may also benefit, especially from tinted sunscreens.
Okay, so everyone should still always wear sunscreen. All right.
Yes.
So what about makeup? Because I know most foundations, they have at least SPF 15 or SPF 30. Do you need to put additional sunscreen on that as well?
That's another wonderful point to make. A lot of my patients say, I'm covered, I've got that SPF in my foundation, but when I go through the makeup aisle, most of that foundation has SPF 15, and we want you to get at least 30 or higher. So there's a lot of great new moisturizers or lotions that have sunscreen of SPF 30 or higher in those. So just make sure you hit that 30 target.
Okay, that makes sense. And speaking of the target for SPF, what about if it's really hot? Should you wear a higher SPF on hotter days versus cooler days?
So a lot of people think that the higher the SPF, the better. However, the benefits after reaching 30 SPF start to drop off a bit. So the most important thing for my patients is to find a sunscreen that you like, that you'll wear, that works with your skin type. And as long as that's 30 or higher and you're reapplying it, you're good to go.
Yes, make sure you reapply, make sure you wear sunscreen. Thank you so much, Dr. Ashley Wentworth. This was so helpful.
Thank you for having me. I appreciate it.